Hello, everyone. Good afternoon. Thank you for joining us. I'm Steve.
And I'm Scott.
And together we are Backyard Musings, broadcasting live Apple Valley, California.
Yep, and definitely talking science and technology today.
We are not masters or experts.
No, we are not.
We're just the messengers.
Right.
It's a good feel-good story today, this afternoon. In a study conducted at São Paulo State University involving 80 women over the age of 45, low-dose vitamin D supplementation nearly doubled the rate of treatment response. A study conducted at the Botucatu School of Medicine at São Paulo State University in Brazil found that low-dose vitamin D supplementation can improve the effectiveness of chemotherapy in women with breast cancer. The findings suggest that vitamin D may serve as an alternative to other drugs designed to boost chemotherapy response, especially those that are difficult to access. This research was presented on March 17th, 2025 in the journal Nutrition and Cancer. Would you like to know more?
Yeah, this is a feel-good story.
Yeah,
anything that can help these.
Definitely.
All right, the research supported by FMB-UNESP included 80 women over the age of 45 were preparing to begin the treatment at Oncology Outpatient Clinic of the General and Teaching Hospital. I'm not even going to attempt that. Hospital das Clínicas at FMB-UNESP. The women were divided into two groups. One group of 40 received 2,000 international units of vitamin D daily, while the other 40 received placebo tablets.
So they got nothing.
Yeah.
Here's your sugar tab. Oh, it's 2,000.
Well, that's kind of what they do, right? Blind studies like that. So.
Yeah. After 6 months of cancer treatment and supplementation, 43% of the women taking vitamin D saw their tumors disappear following chemotherapy.
That's a huge number. I don't care
let's
what
say that
anybody
again.
says.
43% of women taking it.
That's pretty good.
Compared to 24% in the placebo group. So the mind was,
Yep.
Power of the mind.
Yep.
All participants underwent neoadjuvant chemotherapy, a treatment used to shrink tumors before surgery.
Quote, even with a small sample of participants, it was possible to observe a significant difference in the response to chemotherapy. Yep. In addition, the dosage used in the research, the 200 international units or 2,000 international units per day, is far below the target dose for correcting vitamin D deficiency, which is usually 50,000 international units per week.
So 50,000 per week divided by 7. What is that? 7,000 per day. 7,000 per day every day.
Yeah, a little over 7,000, right?
Okay.
And this is according to Eduardo Cavalho Pessoa, president of the São Paulo Regional Brazilian Society of Mastology and one of the authors of the article published in the journal Nutrition and Cancer.
Vitamin D is a hormone that helps the body absorb calcium and phosphorus, both of which are essential for maintaining healthy bones. Recent research, that's milk, right? Vitamin D's in milk.
Yeah,
Ice cold milk.
Lots of other stuff too, but big in milk.
That reminds me, I'm going to pull the chocolate milk out of the freezer. I'm going to do that once we're done. That chocolate milk is delicious. Recent research has also shown that vitamin D supports the immune system and helps fight infections and diseases, including cancer. However, most studies that have explored the connection between vitamin D and cancer have used high doses of the supplement.
This hormone is obtained primarily through the exposure to sunlight and food. Get vitamin D through sunlight too, right? The recommended daily intake is 600 international units for those who are not deficient in the vitamin and 800 international units a day for older people. The American Academy of Pediatrics recommends 400 international units of vitamin D per day for babies. They must put that stuff in formula, then I would guess, right?
Yeah.
It is important to note that too much can be toxic and cause vomiting, weakness, bone pain, and kidney stones.
So we were talking 2,000, and now we're saying 600 and 800. I mean, you just kick it up for that
25%.
Huh. 25? You mean like
600? A little more than 25%.
Oh, wait.
Of the 2,000.
Yeah, but I thought we were talking 2,000 per day.
Yeah, and this is 600 per day, right?
600, so that's 300%.
Yeah, between 25 and 30%. Yeah.
Okay. Most of the participants in the study had low levels of vitamin D, defined as less than 20 nanograms per milliliter of blood. The Brazilians see they're collecting through blood. Remember we did that segment where that device could sense stuff, molecules based on molecules, what you're breathing, so that you wouldn't have to take blood samples? We did that last week or 2 weeks ago.
Yeah, it's been within the last couple of
I wonder
weeks.
if that could have helped here. The Brazilian Society of Rheumatology recommends levels between 40 and 70 nanograms per milliliter. With supplementation levels increased throughout the chemo treatment, which reinforces a possible contribution to the patient's recovery, Carvalho Pessoa told the agency FMB-UNESP.
Quote, vitamin D is an accessible and inexpensive option compared to other drugs used to improve the response to chemotherapy, some of which are not even included in the list of the Unified Health System. The Brazilian National Public Health Network, known as the SUS, its acronym in Portuguese, he adds, unquote.
For the researcher, the findings paved the way for further investigation into the auxiliary role of the substance in the response to cancer treatment. Quote, these are encouraging results that justify a new round of studies with a larger number of participants. I'm all for that. This will allow a greater understanding of the role of vitamin D in increasing the response to chemo treatment and consequently in the greater likelihood of breast cancer remission, he concludes.
Yeah.
Good news.
Oh, yeah. This is one of those really bad cancers, right?
Yeah.
And not so much deadly anymore, but just, they
demoralizing,
and they got to cut parts of your body out.
And fear. And the fear. Shersty was, when she found that lump, she was like deathly afraid. I mean, stressing out.
Right. So, yeah, it not only affects your body, but it affects your mind.
Yeah.
So, I mean, look at that placebo. 24% of the people that
power of the mind and prayer, probably.
It is. It's a powerful thing. And that's definitely right. Power of prayer and the mind. So,
prayer works, folks. We'll see you later.
Take care.